Hello and welcome to TLC for Kids. Teach, Learn, and Connect for Kids. I'm Bryn McBride of ABC for Health, and our TLC for Kids effort today is focused on the Lifeline program in your region of Wisconsin. We're going to tell you a little bit about the Lifeline program, some additional telecommunications assistance available in Wisconsin, and then leave you with some resources. But let's get started. What is Lifeline? It's a federal program that's offered through local phone providers right here in Wisconsin. It can either be a discount on your home phone or a free cell phone. There is eligibility criteria to see who qualifies for either the discount or the free cell phone, but it provides assistance with residential lines, local calls, 911 connection, or a free cell phone. Now, folks find this to be of great benefit if they're trying to stay in touch with their doctor, scheduling appointments, staying connected to a kid's school, or just staying connected as a family. The Lifeline program makes that easier. Link Up is a program you might have heard about that would provide that connection charge when you're getting a home phone for the first time. Now, the Link Up program in Wisconsin has been halted, but if you find you're a person that needs a little extra assistance getting a home phone line connected, you can certainly call the Public Service Commission of Wisconsin and see what your options are. You can also give us a call and we can help facilitate that conversation. But we're going to center our attention today mostly on the Lifeline program, that discounted home phone line or the free cell phone. Who is eligible? Generally, we're talking in terms of financial eligibility, someone that is under 135% of the federal poverty level. Now, if you're not used to thinking about numbers in terms of federal poverty level, think of it in terms of eligibility for other programs. If you receive food share in Wisconsin or Badger Care Plus or Medicaid or SSI, you're also going to be eligible for the Lifeline program. It's good to think about if you're a service provider or an advocate or a sister. If you're helping someone connect to food programs or energy assistance programs or Badger Care, keep Lifeline in mind as well as another benefit you can offer, or another service that's available in the state of Wisconsin. It's underutilized and a lot of folks in Wisconsin are eligible. About 20% of the state of Wisconsin is enrolled in a Badger Care Medicaid program, which means 20% of the state of Wisconsin could be taking advantage of the Lifeline program. If you live on tribal lands, the benefit is enhanced. Now, we have a separate webinar on Lifeline programs for tribal lands. It goes into more detail, but keep in the back of your mind, if you do encounter someone living on tribal lands, they might be available for enhanced benefits. Now, there are a couple restrictions on the Lifeline program. It's a one per household benefit, which means if someone is a dependent of yours, if you're getting a free cell phone, they can't also get one. It does follow the rules of dependency. Choosing a company. We hear people say all the time, how do you even know where to start? Well, first you're going to want to assess, are you talking about a home phone here, a wired phone, or a wireless company? Do you want that free cell phone, or would you like to get a discount on your home phone? You know, if you're going the home phone route, we would start by calling your local phone company and asking to speak to someone about the Lifeline program. It might be someone in the billing or account management department. And don't be surprised if you might have to ask for a supervisor, because not too many people are calling asking about Lifeline. So you could give them a call and ask what your options are for a discount on your home phone. The Public Service Commission, and we're going to share this link with you, makes available a list of all of the participating service providers. And this includes the companies that offer free cell phones or the discounted home phone. You will see both wired and wireless providers on this list. You can check that out as well if you want to see if you recognize any names, see a company that you've worked with before. That's a great place to start. Some of the wireless providers actually have the application for the service right on their website, which is one way you could get started. Now, we share one such link with you from the SafeLink program. For example, it's a company that offers free cell phones and participates in the Lifeline program. You can see what an application looks like by clicking on this link that we have shared here. Lifeline, if you do go this free cell phone route, you're going to get a phone in the mail. It's going to come preloaded with a set number of minutes. Minutes are reloaded every month. If you want to use more minutes than what is offered, you will have to purchase them, but it does come preloaded with a set number of minutes per month. Minutes are added generally on the first couple days of the month. It's usually on the front end of the month that minutes are added. And this is going to require a yearly reauthorization. You have to show that you are still eligible at the end of the year to see if you can reapply and get continued service on this. Now, like we said, this is a one Lifeline service per household. If you have more than one adult living in the same residence, that's going to be counted as a member of your household. And you can only use that phone that is sent to you. It's not like you can transfer the minutes to somebody else's phone or to a different phone you might have. You must have a permanent mailing address to get the free cell phone. Now, there are some exceptions to that. If you do find someone that's experiencing homelessness, there are some other ways to get that phone delivered to you. And we'll talk about that in troubleshooting in just a moment. We don't really need to tell you why we think it's important that people are connected with telephone assistance. But if you think of it in a couple different ways, it just reinforces that, like I said, about 20% of the state of Wisconsin could be getting this phone. It's even higher if you think of people engaged in other public benefit programs. And I would bet you that's not the number of people participating in the program. It's a service that's available and underutilized. We know that the cost of telecommunications can get expensive for families if they're already living on a tight budget. So having this extra little bit of assistance literally in your pocket is going to make a big difference. It frees up some of that money that you would be spending otherwise for other resources and needs of your family. We also think about some of the needs of caregivers in the state, parents taking care of elderly parents, or parents taking care of children with special health care needs. Having a phone in your pocket where you can call quickly to connect or to make an appointment quickly or to check on a prescription or to schedule a meeting with a doctor. It just makes it that much easier to know that there is a program in Wisconsin that helps support making that work a little bit better for you so you're not carrying that full burden of cost yourself. Again, here are some troubleshooting tips. The first one we've already talked about. When you first call to say I'd be interested in signing up for the Lifeline program, it might be that you're talking to a company that either does not participate in the Lifeline program or they're not familiar with it. They do participate, but it just didn't make it to that customer service representative. In our experience, it is not uncommon to reach someone that says, you want to apply for what? Make sure you ask to speak to someone, a supervisor, someone in the billing department that could speak to you a little bit more in depth about the Lifeline program. Check that Public Service Commission website listing of all the participating providers first if you want to minimize some troubleshooting. But again, don't be afraid to be persistent and say, I'm pretty sure you participate in this program. Why don't you connect me to somebody that potentially could tell me a little bit more? Local companies may be unaware that they even offer these services, and that sometimes is not just a training issue for customer service. It could be because, there are bigger parent conglomerates that own some of the smaller local phone companies. It might say AT&T participates in the Lifeline program, and they help administer local community telephone company X. Well, that company X might not know that the bigger conglomerate participates. So it could be that you get stuck. That's where we come in. If you are getting stuck or you're getting a no answer when you think it should be a yes answer for participating in Lifeline, certainly don't get frustrated. Give us a call. We'll make the call together with you to the phone company and make sure that we can get you connected to the service that you're eligible for. But of course, if you're hearing other troubleshooting or running into some roadblocks, tell us what you're hearing. Give us a call. We'll work through it together. We want to make sure that people are getting connected to the services they are eligible for. Maybe it might be that you're not eligible. Maybe there was a factor in the eligibility that we need to help explain or figure out ourselves, and we can do that together. If you are working with a family and they are interested in getting a free cell phone, make sure that you go over some of these criteria of eligibility and what that free cell phone, for example, might look like. That minutes are loaded at the start of the month. That's a better time to stay organized and stay in contact with doctors, or call the local consortium if you're renewing your Badger Care. Don't wait until the end of the month where you might be running low on minutes. So there's some good best practices when using something like the free cell phone that comes from Lifeline. Now, I said we would do some troubleshooting if you're working with folks experiencing homelessness. A couple tips: if you can demonstrate that that person is living in a shelter and that's established as a separate household than somebody else, you can have that free cell phone sent right to that shelter. A phone can also be delivered to a P.O. box. That is really handy for a lot of folks that might be a little bit more mobile or not in a permanent housing situation. Having a P.O. box set up will be a really great resource for that individual, and the phone can be sent there. Now, we're going to spend the last couple of minutes talking about one other program that's administered by the Public Service Commission here in Wisconsin, and that's the Telecommunications Equipment Purchase Program. This is separate from Lifeline, But as long as we're talking about ways of making sure people can connect to telecommunications, I thought I'd put this on your radar as well. This is a program administered by the Public Service Commission right here in Wisconsin that helps individuals who have disabilities buy specialized equipment that makes basic phone service or telecommunications easier. This might mean something like helping someone connect to an amplified headset or a visual display on their phone that's a little bit larger, or a signaling system if they need a little help being notified that the phone is actually ringing. To be eligible, it's very different than the Lifeline program. It is not looking at your income, it's not looking at your age, it's looking solely, first, if you're a Wisconsin resident, and if you have a condition that is disabling that makes telecommunications difficult. There is no income test, there is no age test. It's going to see if you have a disabling condition and therefore you could use some specialized equipment. This is a voucher program. You get a voucher once every 3 years through this TEP program. Now, how much does that TEP voucher pay for some assistance in getting connected with some of this equipment? It's really going to depend, and it depends on the type of disability you disclose on your application. It works like this. You pay the first $100, the TEP program pays the balance, the voucher pays the balance. So if you have hardness of hearing or a speech impairment, or you're experiencing deafness with low vision, that voucher amount might be for a dramatically different amount because of the type of equipment it would bring into your home. Now, some people raise a red flag right away and say, wait, the folks that I'm working with can't afford that first $100 out of their own pocket. That's where the TAP program comes in. This is an assistance program that runs as a corollary to that equipment purchase plan. The telecommunications assistance program is there if someone cannot afford that first $100. So it gives you a little bit of a support and then the voucher. Now, there is a phone line that's available if you do have questions on the TAP program, on that assistance program. But overall, if you're interested in the TEP or TAP program, if you're interested in telecommunications equipment purchase plan and then might need a little extra assistance, you can get started. And we have a link here, tep.whipfleet.com. That'll get you started. You can also find applications on the Public Service Commission's website, or you can give us a call and we can get you hooked up as well. You can do the application on paper. You can also do it online. It is faster and processing goes faster if you do it online, but we know that's not for everybody. Usually it takes a couple weeks for that application to be processed. Online, again, is going to speed that process up. Once that is complete, you will find a decision of whether that voucher has been approved. And like we said, this is something that is good once every 3 years. So once you're getting close to that 35th month of having the TEP or TAP program in your household, you can start thinking about renewing that voucher. We've talked about a lot of telecommunications assistance programs today, either the Lifeline program for the home phone discount or free cell phone telecommunications equipment purchase plan, and then the assistance plan if somebody needs a little extra support affording some telecommunications equipment in their home. If you have questions on any of this, the Public Service Commission is a resource for you, but you can also contact us at ABC for Health. We work with a lot of families, and most of them are eligible for some of those extra assistance resources, and we'd be happy to help determine if you're eligible to and get you started in getting connected. Thanks for joining us for TLC for Kids. I'm Bryn McBride. We'd be happy to talk with you more about these programs. Give us a call. Thank you.